Today, let's talk stretch marks. They are dermal tears. What's a dermal tear? Well, imagine if your baby, when your baby was inside of you, if your baby was playing with a little knife and was just nicking your skin from the inside out, but the knife never quite made its way through the surface, through the epidermis. So they are tears in the deeper layers of the skin, what is called the dermis. There's two layers of the skin, the epidermis and the dermis. So a stretch mark is a dermal tear. So there is no minimally invasive procedure that treats stretch marks. Now, let me repeat that because I get that question all the time from patients. What procedure can I do that gets rid of stretch marks? There is no surgical treatment for stretch marks other than removing them. So there are lasers that improve color because many times stretch marks have a darker color. So if you laser them, you can make them look a little bit less conspicuous because it looks like the surrounding skin. But there is no laser that improves stretch marks. There's fillers that you can sort of fill a little bit, but they don't really give a big difference. So what the treatment is to cut them out. So it's very typical for patients, and I see it a lot more in thinner patients when they have big pregnancy bellies, that the skin just stretches so far forward that that skin stretches and tears, and you end up with this. So we see is stretch marks everywhere. Just all of these little white lines are little stretch marks, okay? And obviously in addition to that, she has all the loose hanging skin. She has a little bit of fat accumulation on her waist here. And of course she has so much extra skin that you can see that the belly button has taken on that inverted triangle look. How are we going to fix this? We're going to do a tummy tuck. So I'm going to make an incision that will be hidden in her bikini line, and then we're going to be getting rid of all of this here. So I should be able to get rid of about 90% of her stretch marks, and we're going to stretch this down to here. We're going to stretch this direction. That's going to tighten her waist. It's going to leave her flat, and of course muscle reconstruction to leave her flat. And here we see the after result. So you can see there's almost no stretch marks left. She has a few very small ones down here because these were very high before. So it was impossible to get rid of all of them, but she has probably had about 90% reduction in her stretch marks. Her abdomen is flat now. She has a nicely defined waist, and her scar is hidden below the bikini line. So I lied. There is a treatment for stretch marks, but that treatment is a tummy tuck. There is no minor surgery that removes stretch marks. We actually have to physically remove them, and a tummy tuck is a wonderful way to do this.